In a world overrun with the fake, delusional, and disingenuous, he stands as a beacon of truth. He is Abuki Cabal. You are listening to Abuki Cabal.
Welcome to the Abuki Cabal Show.
What's going on, ladies and gentlemen? Welcome to the show. I appreciate you guys sticking with me, supporting the show. Hopefully we can set some people on the right path to think properly about what we consume, about what we read, what we allow to enter into our mental spaces. This is going to be a bit of a lesson. You know, I think that I've touched on, time and time again, with these people out here spreading misinformation and causing people to make bad choices or to be paralyzed with fear regarding their position as they see it after being exposed to disinformation or misinformation and good information, hitting them at all sides, from all sides. It can be overwhelming, especially to a lay person or a person who doesn't have a scientific background or doesn't have a methodical way of breaking down information into consumable bite-sized portions in order to be able to better analyze that information. Let's talk about this Oregon doctor who had been spreading misinformation for months, if not the last couple of years that we've been dealing with this situation with COVID-19, the original strain, now up to Delta. And this particular doctor from Oregon said mask wearing could lead to carbon dioxide poisoning and got his medical license revoked. This is important because there are starting to be repercussions from people spreading information, misinformation, without any kind of consequences. And, people are out here dying. People are out here getting sick needlessly because they listen to these people, because they, frequent certain platforms due to their political positioning and not based off of them providing factual information to the public at large, which is supposed to be the reason for these news organizations to exist in the first place. Okay. So, we got the Oregon Medical Board has revoked the license of a doctor who refuses to wear masks. Stephen Arthur Tulepi ran a family clinic and was found to give false information about mask wearing. He told the board he would continue to refuse to follow the COVID-19 guidelines like wearing masks. So you have a person who is a medical professional who refuses to go by the information, credible information that was good enough for him to follow to get out of school, but is not good enough for him to disseminate to his patients. So they snagged his license because he was found to basically be doing a harm. The main thing that medical professionals are not supposed to do, especially doctors, is to not give out harmful information, to not cause harm to their patients. And here you have a medical professional based off of his political ideology causing harm to people because he feels like it will get a particular person in office. And, you know, for as long as I've been alive, I've never seen anything like this. And as long as I've been out of school and working, I've never heard of anything like this before, you know. But again, you know, and I say this to content creators also, you guys need to know that there are going to be ramifications for this. I mean, YouTube is already snagging platforms, you know, not even given a chance, snagging platforms for people putting out misinformation. You'll be gone. And then after that, you don't know what's coming down the pike. This man may be responsible for monetary damages. I mean, the potential for being sued and actually losing is here. You know, maybe, you know, lead attorney and some of our other folks in the manosphere can touch on this and the implications this could have. But I'm going to stick to the basics. I'm going to stick to what I know. So let's move along here. Okay. So here's the article here. And this is by, the Insider. And there's a credit to the person who wrote the story, Yelena Desanova, a doctor from Oregon, who said mask wearing could lead to carbon dioxide poisoning, got his medical license revoked. And over something as crazy as that. I mean, how long have people been wearing masks? People have been wearing masks ever since they've been doing surgery. What, like the early 1800s and 1900s, people have been wearing masks and nobody's dropped dead of carbon dioxide poisoning. I mean, this is totally irresponsible, but let's move along. Okay. I've already covered these. The board gave him a chance to testify. So he testified before the board that he was not going to stop doing what he was doing. Okay. So here we go. An Oregon doctor who falsely described carbon dioxide poisoning as a risk of wearing a face mask has had his license revoked. As of September the 2nd, Stephen Arthur Talipi was no longer allowed to practice according to records from the Oregon Medical Board. La Talipi also received a $10,000 fine. An investigation conducted by the Oregon Medical Board found that Talipi engaged in 8 instances of unprofessional or dishonorable conduct, 22 instances of neglect or negligence in the practice of medicine, and 5 instances of gross negligence in the practice of medicine. A report relaying the investigation's findings said La Talipi's family practice, Southview Medical Arts, did not ask patients whether they had been in close contact with someone who exhibited COVID-19 symptoms or tested positive for the disease. The report said La Talipi had also asked his receptionist to screen people for COVID-19 by looking at their facial expressions rather than asking common screening questions. If the patient was smiling and happy, the receptionist was instructed to ask how the patient was feeling, the report said, adding, if the patient indicated that they felt fine, they were not ill, the receptionist would direct the patient to sit in the waiting room area before heading to an examination room. Neither La Talipi nor his wife, who ran the clinic with him, wore a mask from March to December of last year while treating patients. The investigation found La Talipi was also found to have told patients they didn't have to wear a mask in the clinic unless they were actually ill, coughing, or congested. Masks have been shown to reduce the spread of coronavirus. Additionally, the report said Latulepi told older and pediatric patients that mask wearing was very dangerous for them and could exacerbate asthma or cause or contribute multiple serious health conditions, including strokes, collapsed lungs, and pneumonia. He also was said to have claimed mask wearing could lead to carbon dioxide poisoning, a falsehood debunked in the report. The report said Latulepi believed he'd been a strong asset to the public in educating them on the real facts about this pandemic. The board originally suspended his license in December when investigators asked whether he planned to follow COVID-19 protocols like wearing masks. Latulepi said no. And I quote, "In a choice between losing his medical license versus wearing a mask in his clinic and requiring his patients and staff to wear a mask in his clinic, he will choose to sacrifice my medical license with no hesitation," the report said. Investigators wrote that his decision to flout COVID-19 guidelines like mask wearing was irresponsible and actively promoted transmission of the COVID-19 virus within the extended community. Okay. It says, and it gives a few links down here. How to tell if your symptoms are COVID-19, a cold, the flu, or seasonal allergies. Okay. One chart shows how well COVID-19 vaccines protect you against the Delta variant. 5 most common COVID-19 symptoms based on your vaccination status. How, where, and when to get your COVID-19 booster shot. CDC, everyone should mask up indoors whether they're fully vaccinated or not as the Delta variant sweeps the U.S. I said this when they originally said that we could stop wearing masks. I told all the people that I knew not to stop wearing a mask. You know, everybody I could tell, I told them to not stop, to not stop. You know, because the evidence that was out there didn't show that was the position that we should take. So I stand by that, and everything that's coming out shows that I was right about that. You know, not to throw it up there, but it's true. That's why you should read this material and see where it leads you and do what it points you in the direction of doing. You know, you just should not allow these people to guide you in the wrong direction. You know, misguided beliefs and whatnot. I mean, there's no time for that. You know, but I just wanted to share this with you guys. And, you know, again, you know, more of the same. You know, it's unfortunate, but this is where we are. You know, I really hate that you know, this type of stuff is still going on. And we're seeing it in states like Oregon, you know, and these other states that didn't comply in the first place. But if you go back and you connect the dots, you look at all the places that had problems initially, you look at the places that are having problems now, and the common theme is that these people are deniers of the existence of the vaccine initially, and then later on, then all of a sudden, okay, it's a serious problem. And, but you know, you don't have to wear a mask, or you don't have to do this, you don't have to do that. None of the things that the scientific community are advocating. It's their own feelings and whatnot. And in this community, you know, a lot of us call ourselves red pillars, you know, which, you know, the basic concept of that is truth. We accept the truth as it is, and we move accordingly. And that's what this is all about, you know, accepting the truth and moving accordingly. all these people are out here saying, well, that's your opinion, and there, two things can be right at the same time. That's a slippery slope. You have to realize that a lot of times these people, when they say these things, that's your opinion, that's a cop out for saying, I'm going to do what I want to do, regardless of what the evidence says. I'm going to do what I feel like I want to do. And that's a child's response. That's not an adult's response, and we, as men in this space, we have to do what we're supposed to do as men, and that's lead based off of factual information. If you're a general on a battlefield, you have to survey the battlefield and move accordingly, not how you feel, but how the evidence, presents itself. I could go on and on, but I won't. I'm a little stopped up here. I'm tired. I come in, I do these shows after I work, and I look at this stuff, and I fight my own battles of, feeling like fighting a never-ending battle of sickness, death, and the normal things that most people can't really deal with. So it takes its toll on me, and I'm going to talk more about that. I've already talked about how nurses and doctors are just saying, forget it. How am I going to be able to deal with this again? We're moving up to, flu season. You're looking at, yet another battle, another year of dealing with this, and I'm trying to stay upbeat. I appreciate everybody listening. I appreciate those who tell me that I'm helping. I even appreciate those that are coming in that are asking questions. I appreciate it. I appreciate the discourse, and I appreciate the community. I thank you guys for coming out. Thank you for the support, the donations. I'm going to try to continue to grow the channel. If you guys have anything that you want me to cover, anything that you want me to look into, I'd be glad to. Like I said, I work quite a bit. So, in between, taking care of patients and whatnot, I still have my phone, so I can kind of read articles and try to hit them, when I come in, if I've got the strength. So bear with me, guys. I see, some guys come in, or some folks come in, my numbers will go up, then my numbers will go back down. Like, people just don't want to, I guess, stick around, or don't want to give me the time to kind of, research and then put the information out. But I can assure you that it is necessary. Again, I appreciate you guys. Thank you, guys and girls, ladies and gentlemen. Again, thank you guys. It's been fun. Hope to get a steady stream of good information out there. But thanks again, y'all.
You are listening to Abuki Cabal, the analytical savage.
I feel like a motherless child, a long way from home.